And we're back now with the doctors. You know, there's a brand new study that finds the percentage of middle-aged men taking testosterone has increased substantially in recent years. So what are the benefits and the risks? Dr. Samadi, how do we know we should take testosterone or not?
Eric, a lot of times it's as a result of the diagnosis of male menopause. When your testosterone gradually over the years slows down, you're going to have those symptoms of being fatigued, low libido, not being able to move, weight gain, etc. So that's when you want to talk to your doctor about this. Unfortunately, I think the number of the prescriptions have almost quadrupled over the last decade, and I think there's a lot of knee-jerk reaction going on with this testosterone. Every day goes by that you see the ads and all these clinics are opening up. So you got to be very careful about who should be on this. Number one, you want to make sure that you get your testosterone early in the morning because that's when it's really high, and never check it in the afternoon. Also, always check free testosterone. Ask your doctor, not my total testosterone, but what is my free testosterone, which is the active form of testosterone. And finally, I want to say that a lot of other conditions can reduce your testosterone. For example, obesity can convert your testosterone to estrogen. Depression can do it. So you want to make sure that you treat the underlying disease, not the actual just giving the prescription to the medication. While there is a benefit as far as testosterone, as far as heart condition and prevention of osteoporosis, and we understand that well, there's also risk of getting clotting and acne and breast enlargement. So you want to talk to your doctor and find out exactly what your number is and then treat it.
Wow. Well, Mark, what do you say when you go to your doctor to discuss this?
Well, you know, Eric, the good news is I can be the detective, and if I find the problem, then I can refer the patient to David to figure out the solution, because it's actually controversial when to treat. But I'll tell you one thing. I check testosterone levels in all men over the age of 50, and I get suspicious if they are gaining weight, if the way David said, because if they're gaining weight, it could be because their testosterone is low and they're getting more estrogen and less testosterone. Same thing with cholesterol. If their cholesterol is going up, I'm wondering if testosterone is playing a role. Diabetes is related to this. Heart disease is related to low testosterone. So I don't want people to have the problem, and I start to look for it. Now, sometimes there are other issues involved, like thyroid disease. Sometimes I fix the thyroid problem and the testosterone problem is less. Now, people that have had prostate cancer, David's specialty, or are at risk for it, I worry about that, and I check a PSA at the same time. If you're on testosterone replacement therapy, you should have your PSA followed.
David, how crucial is that in dealing with the prostate?
Well, the only thing that I would add to it is that there's really no cause and effect when it comes to testosterone and prostate cancer, but there's a very strong association, especially if you are at high risk, African Americans, or if you have family history of prostate cancer. You want to make sure that you check your PSA before you go on all these testosterones, and you want to make sure you monitor your PSA with your doctor very closely.
All right. Very good advice as always. Thank you.
A lot of interest in that topic.